Let's go through just some standard memory tests, and what I want you to do is try to remember a few things, and I'll ask you again in a couple of minutes. First of all, just 3 words: Chevrolet, zebra, and honesty. What are they?
Chevrolet, zebra, and honesty.
Okay, and now 3 things around us in the room right now. That TV monitor that's right next to you there, the computer, my stopwatch, and this particular book. Okay? So what are the 3 things in the room?
TV, the stopwatch, and the book.
Okay, great. Try to remember the words and the things in the room, and I'll ask you again in just a couple of minutes. Okay. What day of the week is today?
Today's Saturday.
And what city are we in?
Boston.
And what is the date?
October 21st, is it? No, I'm sorry, November 21st.
Okay.
You wrote it down.
I did. I write down everything you say.
Look at my dates.
19.
Actually, I don't keep track of dates anymore.
Yeah.
I haven't had
Things
to.
have changed.
Yeah. 1998.
Okay. Sure. Okay. Now, who's our president now?
Clinton.
And who was president before him?
Reagan. I mean Bush.
Mm-hmm.
Sorry.
No, that's okay. That's common for all
Very
of us.
common.
Very common for all of us to do. And then before him was?
Reagan.
Okay. And then just one before that. Who was that?
Carter.
Yeah. Okay, good. Now, tell me some newsworthy events that are going on in the world today. What's going on that you know about?
That's a good question because I played golf for 2-3 days. I haven't been watching. Well, actually, the hearings, presidential hearings.
Yeah.
It's been
For
going on.
what controversy or case was that about now?
Monica Lewinsky case.
Yeah. Okay.
The star hearings and debates. And,
Okay.
I guess for the impeachment hearings. That's what it's got.
Very good. Now, what I want you to do is to spell world backwards.
DLROW.
Okay. Very good. Show me how you would use a comb to comb your hair. Okay. And how you would blow out a candle. Okay. Good. Now, what I want you to do is to take this page. I want you to draw the face of a clock. Make the circle big enough and put the numbers in. And then set the hands at 10 past 11.
I haven't had to do this for a long time. 10 past 11, you
10
said?
past 11. Now, say this after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. Now what I want you to do is to tell me those 3 things we pointed to in the room.
TV, the watch, and the book.
Okay. And the words before that?
Chevrolet, zebra, and honesty.
Okay. Very good. Now take this back and anywhere on here write any simple sentence, a complete sentence that you make up. It can be very simple. That's intended to be a 3-dimensional drawing. Okay. So do a representation of a cue yourself. let's say this is a map of the United States, okay? This whole page, let's use a brand new one, okay? So if you just picture the whole United States fitting on this right now, put a C where California is, and F where Florida is. Okay, where's your hometown? And just put the initials for that. Okay. And where would Denver be? Example. Okay. And how about the Gulf of Mexico? Okay. Other mental status issues, that's pretty much all I would do right now in a screening examination. You've got geographical orientation, you've done memory, both for verbal and nonverbal or visual information. We've looked at historical information, we've looked at current events, we've looked at language skills. The only thing we would probe more deeply would be focused concentration and attention and mathematical skills and those sorts of things. And at least for right now, we won't be doing that on this level of testing. So it's worked out just fine. What you're able to do here, having seen you operate all day long, knowing that there aren't any problems, it's certainly adequate information for me. Things are working just fine.
So I'm going to start by just asking if you could cover your left eye with your left hand and look straight at my nose and just point to the finger that I wiggle. Okay.
Both.
Good. Yes. Good.
Both.
Mm-hmm.
That. Both. That. Both. That.
Good. Okay, switch eyes. Look straight at my nose and do the same.
Both. That. That. Both. That. Both. Both.
Good. Okay, now just watch my finger. Move your eyes to follow it, but don't move your head. Good. Now keep looking at my nose. And then we'll look at the finger. Back to my nose, finger, nose, fist, nose, fist. Good. Keep looking at the finger as it moves in. Good. Now keep looking straight ahead. And I'm going to be shining a light in your eyes. Just ignore it. Don't really focus on anything. Good. Open your mouth wide. Say ah.
Ah.
Good. Stick your tongue straight out. Move it side to side. Okay. Open your mouth wide. Don't let me close it. And now close it tight. Don't let me open it. Move your jaw side to side. Good. Make a big smile. Okay. Now close your eyes as tight as you can. Open them wide. Okay. Does it feel the same when I touch you here and here?
Same.
Here and here?
The same.
Here and here?
Same.
Do you hear that?
Yes.
And that?
No. Yes.
Good. Put your arms straight out in front of you like that. Spread the fingers wide. Close your eyes. Keep your eyes closed and touch the tip of your nose with the tip of your right index finger. Okay, now your left. Good. Open your eyes, and I'm going to test some muscles. Shrug your shoulders up like that. And keep them up. Don't let me push down. Good. Relax. Turn your head that way. Don't let me pull back. And the other way. Same thing. Good. Put your arms out like that. Don't let me push down. Go like this. Don't let me pull out. Put your hands like that. Don't let me lift up. Same here. Push down hard. Good. Put your arms out like that. Don't let me push down. Go like this. Don't let me push the fingers down. And spread the fingers wide apart. Don't let me push them together. go like that. Don't let me pull up. Put your hands like that. Pull the fingers up. Don't let me straighten them. Pull those fingers up. Don't let me straighten them. Good. Relax your hands. I'm going to touch you on the right, the left, or both. Close your eyes. Tell me which I touch.
Right, left, left, both. Right, both.
Good. And I'm going to take your thumb. I'm going to move it either up or down. Close your eyes. Say which way it goes.
Up, up, down, down,
Good. Same thing over here.
down, down, up, down, up, down. Can't tell. Up, down.
Good. Feel that vibrating?
Yes,
And there.
yes.
I'm going to take a safety pin and I'm going to touch you with either the sharp or the dull. Close your eyes and say sharp or dull.
Sharp, dull, sharp, sharp, sharp,
Same thing on the other hand. Ready?
sharp, sharp, dull, sharp, sharp.
And does it feel equally sharp here and here?
Yes, it's equal.
Here and here?
Yes, that's equal.
Good. Take your right hand and go like that as fast as you can. And now the left. Good. With the left hand, go like this. Now that hand. Okay. Take your finger and touch your nose. Touch my finger. Go back and forth as fast as you can. Now your other hand. Good. Okay. Can you cross your right leg over your left? And I'm just going to test your reflexes here. While I do this, I'm going to test your memory. So I'm going to tell you 3 things to remember, and I'll test you in a few minutes. A cauliflower, a bicycle, and happiness. So,
Cauliflower, bicycle, and happiness.
good. Say those over and over to yourself and try and memorize them because I'll be distracting you.
Cauliflower, bicycle, and happiness.
Okay, I'll be testing you in a few minutes, and in the meantime, I'm going to be asking you questions. Some of these will be easy, and don't be offended that they're too easy. Some may be hard, and don't get upset if they're too hard. First, can you just tell me what the date is today?
February 16th, 1996.
And where are we right now?
We're at the University of Michigan, Department of Neurology.
And what's your full name?
John Joseph Wald.
Can you tell me who's the president?
Bill Clinton.
And who was president before him?
George Bush.
And before him?
Ronald Reagan.
Before him?
Jimmy Carter.
And before him?
Gerald Ford.
And before him?
Johnson, maybe. Oh, Nixon.
Okay.
And then Johnson.
And before him?
Kennedy.
And before him?
Truman.
Good. Eisenhower.
Okay.
Cross your legs the other way. Can you just repeat after me? We all went over there together.
We all went over there together.
No ifs, ands, or buts.
No ifs, ands, or buts.
Each football game brought the quarterback closer to the championship.
Each football game brought the quarterback closer to the championship.
Good. You can relax your legs. Repeat these numbers back to me. 8, 3, 5, 4, 1, 7, 9, 6.
8, 3, 5, 4, 1, 7, 9, 6.
Good. I'm just going to give you a math problem. Suppose you went to the store to buy 6 pieces of candy and they cost 12 cents each. How much change would you get from $1?
28 cents.
Good. What is 100 minus 13 divided by 3?
29.
Good. These will seem like silly questions, but if a lion was killed by a tiger, which one is still alive?
The tiger is still alive.
Is my aunt's uncle a man or a woman?
He's a man.
And what do an apple and an orange have in common?
They are fruits.
What do a basketball and a grapefruit have in common?
They're round or spheres.
What do a tent and a cabin have in common?
They're shelter.
What do a painting and a symphony have in common?
They're works of art.
What's the difference between a river and a lake?
The flow and the size.
What's the difference between a baby and a midget?
Their maturity.
Good. What were those things I asked you? And what were those 3 things I asked you to remember?
A bicycle, cauliflower, and happiness.
Good. Okay. I'm going to ask you to pull your knee up towards your nose. Don't let me push down. Good. And push down hard. Don't let me lift up. Okay, pull this knee up towards your nose. Don't let me push down. Push down hard. Don't let me lift up. Good. Now I'm going to lift your leg for you. Pull your foot back under the chair. So bend your knee. Don't let me straighten it. Okay, now straighten it all the way out. Good. Same thing here. Pull back. And now push out. Okay. Put your feet like that. Pull the toes back towards your head. Don't let me push down. Push down hard. And here. Okay. And relax. All right, now I'm going to touch you on the right, left, or both again. Close your eyes. Tell me which I touch.
Right, left, right, both, left,
Good. Does it feel the same here and here?
same.
Here and here?
They're the same.
All right. Now I'm going to take your big toe and I'm going to move it either down or up. Keep your eyes closed. Say which way it moves.
Down, down, up, down, down,
Good. Same thing on the other side.
down, up, up, down, down, up.
Good. And now, do you feel that vibrating?
Yes.
And there?
It's not vibrating.
Now?
Yes.
Good. And again, I'm going to take a safety pin and touch you with either the sharp or dull. Just tell me which.
Sharp, dull, sharp, sharp, dull, sharp, sharp,
Is it equally sharp there and there?
equal,
There and there?
equal.
Good. Okay, I'm just going to hold your leg for you and just let yourself relax as much as you can. I'm going to scratch the bottom of your foot. It will be a little uncomfortable. Do that once more. Okay, and now the other foot. Okay, while I hold this one here, can you take the other heel, put it on your knee, and run it straight down the front of your shin? Good. And now let's switch legs. Do the same thing. Good. Okay. Just let your leg be loose here. I'm just going to move it for you. Let it be as relaxed as you can. Same thing with your hands. With your left hand, can you just tap your leg as fast as you can? Good. Okay. And now with your right hand, tap your leg. Good. Cover your left eye one more time. And just read the lowest line on this card that you can read. You can hold it.
2, 6, 4, 5, 9, 7.
Good. And the other one, the other eye.
3, 2, 6, 8, 4, 5.
All right, and just look straight ahead. I'm going to be looking in the back of your eyes. Just try and pick a spot on the wall there and keep looking at it as if my head weren't in the way. Okay. Now I'm just going to write some numbers on your fingertip here. Close your eyes and tell me what number I write.
3,
Good.
1,
Mm-hmm.
4,
Good. Same thing over here.
8,
Good.
1,
Good. And close your eyes again. Tell me what I put in your hand here.
It's a coin. Might be a dime or a penny.
Good. And over here.
It's a coin. It's a nickel.
Good. Okay, the last thing is to watch you walk. Can I have you just stand up over here? We're in tight quarters, so I'll just have you walk a short distance. Stand here, why don't you? And turn around. Walk on your heels with your toes up in the air. And now walk on your tiptoes. And walk with the heels touching the toes like that.
Now, Debbie, could you pop onto the couch for an examination? Good. And if you just rest yourself back, get comfortable. All right? Mm-hmm. If I could start by looking at your hands, thanks. And let's have a look at that one. Good. Just feeling your pulse. All right. Can I look in your eyes? If you could look up for me. That's good. And could you open your mouth? And pop your tongue out for me. Good, thanks. I'm just going to feel your neck. Could you sit forward for me, please? I just want to feel your neck from behind here. Good. Now I'd like to lie you flat. Will you be all right with one pillow?
Yeah.
Okay, there we are. If you could. Good. And can I have a look at your tummy? If you could lift your shirt up and just push your skirt down a bit. That's good. Thanks very much. I'm just going to feel your tummy now. Does it hurt you anywhere?
No.
Good. I just want to feel a bit more deeply. Not hurting you. Good. I want to feel for your liver. If you could just breathe in and out deeply. Good. And just keep going with deep breaths in and out. Okay. Just going to feel your left kidney. Could you just roll towards me a little? That's good. And now just rest back. Okay, same on this right side. If you could just roll away from me and rest back again. Good. Now I'm just going to tap on your tummy. Okay, and last thing is just to listen for some bowel sounds.
Can you tell me whether you wear spectacles, please?
No.
No. Okay, I'd like you to read some print off here. Could you take that in your hand and cover up your right eye, please? Could you read the top line?
He moved forward a few steps. The house was so dark behind him, the world so dim and uncertain in front of him.
Okay. Could you swap eyes and hands now, please?
Then he heard a sniff, felt something warm against his leg. He had almost stepped upon the animal. He bent down and stroked its wet coat.
Okay, that's great. Thank you. Could you cover your right eye with your right hand, please? Now, I'd like you to look and concentrate in the centre of my eye. And I'm going to bring my finger in, and when the finger moves, I'd like you to say yes.
Yes. Yes.
When I'm doing this, I'm comparing the patient's visual field with my own.
Yes.
Okay. Could you swap eyes now, please?
Yes. 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 Yes.
What I'd like you to do, please, is to look behind me at the clock and focus on the clock and not look straight at the light. Please notice for doing this, I'm using the ophthalmoscope for examining the patient's right eye in my right hand, and I'm going to look into his right eye through my right eye. First of all, I'm going to examine the red reflex. I'm now going to move closer to examine the back of the eye. I'm looking at the optic disc, I'm looking at the vessels, and I'm now going to scan the rest of the retina. I'm now going to move to look in the left eye. I'm going to swap the ophthalmoscope into my left hand, and I'm going to examine the patient with my left eye, looking at his left eye. Again, if you could look into the distance, please. Again, check the red reflex, and then examine the back of the eye. What I'd like to do is get you to focus on the tip of my pen. I'd like you to follow with your eyes and keep your head still. I'd also like you to tell me if you see double at any position.
Right.
Okay. So if you could just follow my pen. I'm taking the patient's eye movements to the extremes of horizontal gaze first. I'm then examining vertical gaze. At all stages, I'm looking to see if there's any nystagmus in any particular position. I'm now going to test for the movements of the oblique muscles. Okay, so you didn't see double in any of those positions?
No.
As the eyes converge, both pupils are seen to constrict. I'm now going to test the sensation on your face. I'd like you to tell me if it feels the same on each side.
Yes. Yep. Yep.
Can you clench your teeth tight? Keep clenching. I can feel the temporalis muscle contracting. And again, please. I can feel the masseter contracting. Can you open your jaw now, please? The pterygoid muscles open the jaw in the midline. Could you keep it open for me? The pterygoids are strong and I should not be able to overcome this movement. Can you move your jaw from side to side? If the right pterygoid muscle is weak, the jaw will deviate to the right, and if the left is weak, it will deviate to the left. Could you raise your eyebrows fully, please? And we're looking for wrinkling of the forehead due to contraction of the frontalis muscle, and this should be symmetrical. Can you now screw your eyes tight together? We're testing the orbicularis oculi muscle, and I shouldn't be able to open the eyes. Thank you. Now, can you smile like this, please? And I'm looking for symmetry of the smile and equal action of the orbicularis oris muscle. Now, can you blow out your cheeks? This is a function of the buccinator muscle. I press gently and see if there's any incontinence of air and escape of air from the mouth. Thank you. I'm going to cover one ear and whisper a number in the other. Would you tell me what the number is, please?
36.
Yeah.
43.
Thank you. I'm going to do some tuning fork tests. This is the Weber's test. Can you hear that vibrating?
Yes.
Does it sound louder on one side or the other?
It's the same on both sides.
That's normal. I'm now going to do the Rinne test. Can you hear that vibrating?
Yes.
Please will you tell me when it stops?
I can't hear that.
Can you hear that?
Yep.
That's a normal Rinne test. I'll now go on to repeat the test on the opposite side. Could you open your mouth for me? Could you protrude your tongue? Can you move it from side to side? Now can you push your tongue against my fingers? And can you do it on the other side, please? Thank you. I'm going to test your neck and shoulders. Could you shrug your shoulders for me, please? I'm looking for symmetrical elevation of the shoulders by the trapezius muscles here. Next, could I get you to turn your head against my hand? And I'm looking here at the sternomastoid muscle. If we could do it the other side, please. Could you turn your head against my hand again? And again, we're looking at the sternomastoid muscle here. Okay, that's all I need to examine. Thank you.
Just going to get you covered up here. All right. And we're going to lower this gown again. All right. And again, I'm just looking at your chest wall, and why don't you take another deep breath for me? Good. And again. Good. Okay. Just press on you and tell me if this hurts. That doesn't hurt at all. How about when I press like this?
No.
Okay. Over here, or here. Good. Okay. Again, I'm gonna touch you in a few places, and I want you to say 99 when I touch you.
99. 99. 99.
Very good. And I'm gonna just tap on you a little bit. And I'm going to take a listen. So, some nice deep breaths again. Is your mouth open? Good. One more time. Good. Okay. Just going to shine a light now on your neck. And I'm just looking in this area at your carotid pulse and the venous pulsations. And I'm going to try to measure these if they looked elevated. And we would measure them just like that. Okay. So I'm going to check your carotid pulse. And on this side. And I'm going to listen over those areas as well. And stop breathing. And breathe. And stop breathing. And breathe. Okay. I'm just going to feel for any pulsations now on the chest wall. And I'm going to measure that point. That's about 8 centimeters from the sternal line. I'm just going to listen to your heart now. Okay, Mr. Allen, I need you to just roll up on your left side a little bit
Okay.
for me. That's great. Okay, very good. You can roll back. Okay, let's get your gown back on. And I'm going to take a look at your tummy now.
Okay.
I'm just going to pull that down a little bit. And I want to just watch for a second, look for any pulsations. And I'm going to take a listen. That's good. And I'm going to just tap on your belly a little bit here. And I'm going to tap on over your liver. Just going to make a little mark here. And measure that. That's about 6.5 centimeters, which is normal.
Okay, good.
Okay. I'm going to tap over your spleen. Take a deep breath. Very good. Okay, I'm going to be pressing on your tummy now. I want you to tell me if any of this is uncomfortable for you.
Okay.
Just lightly at first. Now a little bit deeper. Okay. I want you to take a deep breath for me. And let it out. Good. Again. Let it out. Good. You can just breathe normally now. I try to feel your kidneys, which I cannot. Okay, very good. And I'm going to check your inguinal nodes now. And feel for your pulse, which is nice and strong. And on the other side, check for your nodes and your pulse. Okay, very good. And we're going to sit up at this point. All right, we're going to start with your arms now.
Okay.
And I'm just going to roll up your sleeves for a second so I can look at the whole arm. And I'm just checking your skin. And I'm going to feel the temperature, feel for any difference. I want to check your fingers for capillary refill. That looks great. Check the palms of your hands. Okay. And I'm going to check for the lymph nodes that sit right up above your elbow here.
Okay.
And on the other side. Okay, normally those aren't felt and I don't feel them. And I'm going to check and compare your pulses. Those are equal. I want to check your sensation in your arms. So the same thing that we did on your face
Okay.
before, I'm going to do on your arms.
Okay.
And again, we're going to try and see if you
Sharp.
can tell a difference between sharp and dull.
Dull.
Okay?
Okay.
So keep your eyes closed and just tell me either sharp or dull.
Sharp. Sharp.
Feel about the same on both sides?
I think so.
Okay.
Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, now I'm just going to touch you with a cotton wisp. And close your eyes again. Just tell me yes when you feel it.
Yes. 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 Yes.
Okay, very good. Okay, we're going to see how strong you are.
Okie dokie.
Okay, and see if I'm as strong as you are.
Okay.
I want you to put your arms up for me and just hold them up. Don't let me push them down.
Okay.
Okay, now push them down. Very good. Put your arms up like this and just hold your arm in.
Okay.
Okay, and resist me. Okay, now open your arm a little bit and push down and push down. Okay, now put your wrists up like this and just hold it up. Good, hold it up. Very good, push it down. Hold it, hold it. Spread your fingers out and just hold them out. Hold them out. Okay, very good. Put your thumb and your pinky together
Okay.
and just hold it. Hold it. Very good. Okay, we're going to check some more sensation in your hands. And if you would just close your eyes again. I'm going to touch you and tell me if you feel something.
Mm-hmm.
And what does that feel like?
A vibration.
Okay, tell me when it stops.
No.
Okay. Again,
Yes.
what does it feel like?
Vibration.
Tell me when it stops.
No.
Good. Okay, with your eyes still closed,
Okay.
I'm going to place something in your hand, and I want you to go ahead and feel it and tell me what it is.
It's a key.
Very good. And I'm going to place another object in this hand.
It's a nickel.
Very good.
1960.
Okay. And now, with your eyes still closed, I'm going to take your finger, and I'm going to place either 1 or 2 points on your fingertip. So I want you to tell me if you feel 1 or 2.
Okay. 2.
Good.
2.
Okay. Let's try on this side.
2. 2.
Very good.
Hello, my name's Vicky and I'm one of the Clinical Teaching Fellows here at Swindon Academy. Today I'm going to demonstrate examination of the cardiovascular system. My patient today is Tim. Hi Tim.
Hi.
Pleased to meet you. Is it alright if I examine your cardiovascular system?
Yes, that's fine.
Thank you. Right, Tim, if I could start by having a look at your hands. Thank you. Could you just put 2 fingernails together for me like that, please? Thank you. And if you could just turn your palms over. That's lovely. Thank you very much. I'm just going to take your pulse now. Let's take over feel the other pulse as well. That's lovely. Have you got any pain in your shoulder?
No, I don't.
I'm just going to lift your arm right up into the air. That's lovely, thank you. Just going to have a feel for the pulse up here. And at this point I would usually take the blood pressure. Next I need to have a look at your neck. Can I just turn your face very slightly to the left? That's lovely, thank you. That's lovely. Now I just need to feel the pulses in your neck. Lovely. Next I need to have a look in your eye. And can I also look in your mouth?
Sure.
Thank you. If you just open your mouth for me. And if you could lift your tongue up to the roof of your mouth. That's lovely, thank you. Next I need to have a good look at your chest, if that's all right. Okay. And I'm going to have a feel for your heartbeat as well. Okay, could you take a breath all the way in, and then all the way out, and then hold it there. That's lovely, and breathe normally. Next I'm going to listen to your heart. It's okay if I feel your pulse at the same time. Okay. I also need to listen in your neck if that's all right. If you could hold your breath for me. And breathe normally. And when you're ready, hold your breath again. That's lovely, thank you. Next I need to ask you to roll to the left. Thank you. And I'm just going to feel for the pulse in your neck at the same time. That's lovely, thank you. And for the next part of the examination, I need you to sit forward, if that's all right. Okay. And if I could just have your wrist so I can feel your pulse again. And we're going to do that breathing manoeuvre again. So if you could take a breath all the way in and all the way out and just hold it there. And breathe away. And then when you're ready, take a breath all the way in and all the way out and hold it there. That's lovely, thank you. And while you're sitting up, I'm just going to have a listen to your lung bases as well. If you could take a deep breath in and out, and again, in and out. That's lovely. I'm just going to press on the base of your back. That's lovely. And if you rest yourself back down, I'm just going to finish off by having a look at your ankles. Thank you, Tim. To complete my examination, I would like to dip the urine and do fundoscopy.
All right. Hi, Megan. Tom.
Hi.
Nice to meet you. All right. So we're going to start just like any regular ophthalmology exam with our core 5, vision, pressure, pupils, motility, and visual fields. Okay. So do me a favor, cover your left eye with your left hand. And I'm just making sure that she isn't cheating and that her hand's totally covering her eye. If you have an occluder available, that's also an easy way to do it. Okay, so just with your right eye, tell me what the smallest line is that you can see on the chart. Very good. Okay, and now switch. And now same thing with the left eye. Good. Okay, so if a patient is able to see 20/40 or better, we kind of let it go at that. If they're seeing less than 20/40, excuse me, I'll use the pinhole occluder to see if there's a refractive error involved. Next thing I'm going to do is check your pupils, okay? So I have a very bright light, I apologize. So I'm going to have the patient focus at distance so that we're not inducing an accommodative reflex and creating pupillary constriction. So the gray light switch, do your best to just stay focused on the gray light switch. Try not to switch to me and focus on the light, okay? So just kind of try to focus on staring off into the distance. And like with any pupil exam, I'm looking at the eye that I'm shining the light in, but as importantly, I'm looking at the eye that I'm not shining the light in, making sure there's symmetry, no afferent pupillary defects, or problems with constriction or dilation. Normal pupil exam, you're doing great. All right, so now we're going to check your visual fields. So do me a favor, cover your left eye with your left hand. Same thing, I'm going to make sure that her hand is completely occluding the eye we're not testing. And then I'm going to line up so that our faces are exactly facing each other, our noses are lined up. And then I'm going to close the eye that is the mirror image of her occluded eye. Okay, Meg, now look right here at my nose, and I'm going to hold my hands up, and you're going to notice I always hold up two hands. A patient's natural tendency is if you put up one hand, they're going to move their eye to look at that hand, and that can give you a false reading because that's sort of a way for them to cheat because they see the quick movement and they focus, and then they see what fingers you're holding. So by holding up two hands, it kind of forces them to stay straight ahead and focused. So you're doing great. Look right at my nose and tell me how many fingers I hold up.
2, 5, 1, 2, 1, 5, 2.
Perfect. Okay, switch eyes for me. Okay, and same thing, look right here at my nose. I usually give them a second to adjust to the light because that eye's been closed for a minute. Okay, keep looking right at my nose, you're doing great. How many fingers?
1, 2, 5, 1, 2, 2.
Perfect. All right, very, very good. All right. Next, we're going to check for motility. I like to use a muscle light with my finger on it. It's just an easy target for both adults and children to follow. So, Meg, do me a favor, keep your head very still, and just with your eyes, I want you to follow my finger, okay? Okay, so like, and we're checking all positions of gaze. And it's okay, I'm just gonna gently lift your eyelids up. And so what I'm gonna do here is just to make sure that they can move their eyes all the way down, I'm gonna hold the upper eyelids up just so I can get a really good view. You're doing fantastic. Next thing we're going to do is check the intraocular pressure. So whatever device you have available to you, use it. There's another good video that will be published using the Goldman applanation. If I have one available, I like to use a tono pen, especially because as part of an orbital exam, I like to check the intraocular pressure in different positions of gaze. That's very important with things like thyroid eye disease and fractures because if an orbit's very congested or there's an entrapped muscle, the pressure will oftentimes rise in the eye when they go off of central gaze. So, for example, with thyroid eye disease, I always check with the patient in primary gaze and then with up gaze. And if there's a significant difference between those two, that makes me more worried about a congested orbit. Okay. So obviously put numbing drops in. We're not actually going to check Meg's pressure, but I have her look straight ahead. And then the other reason I like to use the tono pen is because you can sneak it in between the eyelids. So even if they're coming in with a swollen eyelid because they've had a trauma, you can oftentimes still check the pressure on the cornea without having to open the eyelids up. The reason I worry about that is if they have a lot of edema in their eyelids and you open it up to check the pressure, you're going to artificially increase the orbital pressure while you're checking it. So just try that sometimes. If you have a tono pen, you're doing a trauma eval on a swollen lid, check it with the eyes open and then check it with trying to just get into the palpebral aperture, and you might be surprised at what a big jump occurs when you are mechanically elevating the eyelids, okay? All right. The other things we're going to check with an orbital exam, I want to check to make sure that the optic nerve is functioning well. So this test is called red desaturation. Pick up the brightest, reddest object you can find, often the tip of a phenylephrine or a tropicamide cap. One of the red dilating caps is what works really well for me. Okay, so what color is the cap on that pen?
Red.
Okay, and what color is the cap on that pen?
Red.
Is that the same color red between both eyes?
Yes.
Okay, now I want you to look straight ahead at that light switch again. And I'm going to bring this pen in from the side. Tell me if that pen looks any brighter or darker on one side versus the other. Okay, good. So that's checking for red desaturation. I'm also going to check for brightness desaturation. So again, I'm going to have the patient focus ahead. So look at that light switch again for me. I'm going to shine that bright light in your eyes again. I apologize. And now I want you to tell me is that as bright as that?
Yes.
Okay. If the patient's to say no, it's dim in one eye versus the other, there's a couple ways to kind of try to figure out how much loss there is. It's a subjective test, but I like to say things like, okay, if her right eye is the one where she says it was dim in that eye, say, okay, if that's 100% brightness, what percentage of brightness is that? And they'll give you a number like 75% or 50%, and that's just a way subjectively to check it over time, okay? All right, so moving on to an orbital exam, I want to check your eyes to see if one eye is farther forward than the other, okay? So we're going to use an exophthalmometer so that we can measure for relative proptosis or enophthalmos, okay? This works very well if a patient has normal bony structure. This can be sort of a confusing test if they have fractures or facial deformities, but essentially what you're going to do is the curves of the exophthalmometer, I want these curves to rest right inside the lateral orbital rim. And I try to use a target of the lateral canthal angle where that comes together, where that hooks into the lateral orbital rim. That's going to be the points that I'm shooting for. Okay, this can cause a little bit of a pressure sensation for a patient. It shouldn't be sharp, but especially if they have fractures or they're swollen, it can be a challenging exam. But do your best to try to get bony contact with the exophthalmometer so that you have accurate readings. Okay. So look straight ahead for me again, Meg. I'm going to bring these guys in. I'll be as gentle as I can. Perfect. So you can see I'm right at those lateral canthal angles. I'm parallel to the floor. Okay, and then open up really wide for me. And then what I'm doing is lining up the two red lines that you see in there. You want to move your head until those two lines that are sitting on top of each other. That's your 18 millimeter mark. And then you're looking at where the cornea sits on the scale that you see in the prism. And as long as your red marks are aligned, you're square. Okay, so the red line doesn't mean anything except that that's where they happen to place it at 18 millimeters, and you're worried about where the pupil is then sitting on that millimeter scale. If you have them available, I like to use loupes because I feel I can get 0.5 millimeter increment readings from the exophthalmometer when I'm wearing my loupes. Okay, and then really what's important with an exophthalmometer is that the same person is measuring it to get the same results. Okay, so I might get a different base than another doctor, but it's more important for me in my records that I keep my base the same, and then I can kind of track changes that way. Okay, all right, the next thing I want to do is gently press on your eyes. Okay, so in an orbital exam, you also want to check for retropulsion. Now that's really important if you have a trauma patient, you're worried about a retrobulbar hemorrhage. You have a thyroid patient, you're worried about a congested orbit, or you have any sort of an orbital tumor and you want to make sure that there isn't congestion in the orbit. Okay, so gently close your eyes for me. And then just with my thumbs, I'm just going to gently press on the eyes. And you'll be surprised at how sensitive your thumbs will be in picking up differences in pressure. And if there's a retrobulbar hemorrhage, it'll be as firm as a rock. If there's a tumor, it should be harder to press in. The same thing with thyroid eye disease. It's a good base measurement, and it's also a good way to track changes over time. So you didn't have any difficulties with retropulsion. So far right now your orbital exam is perfect. All right. So moving on to sort of a fracture exam or a trauma patient, we're going to check to make sure that the bony rims are intact. Okay, so again with my thumbs, I'm going to start at the superior orbital rims, feeling for crepitus over the nasal bridge. Okay, and then I'm going to go from here to the superior orbital rims, and I'm just going to move my thumbs out. I like to do it at the same time on both sides so that I can appreciate if there is a difference. A lot of times you can feel a supraorbital notch, or somebody will have unique frontozygomatic sutures that are easier to palpate, but if it's the same between both, obviously it's less concerning. I do pay special attention to the frontozygomatic suture region because that's a weak point, and oftentimes with ZMC or tripod type fractures, you'll feel displacement in that area. And I work around to the lateral canthus, and then I come down across the medial rim. And again, just palpating and feeling for any step-offs or irregularities in the contour. Okay, so that's great. I don't feel any problems there. Next thing we're going to do is check your facial sensation. Okay, so we want to look for V1, V2, V3, make sure that those are all intact and symmetric. So I'm just going to lightly touch your skin. I want you to tell me if that feels the same on both sides, okay?
Yeah.
Feels the same, good.
Yes.
Okay, so here I check the V1 distribution, V2, and then V3. Does that feel the same?
Yeah.
Perfect. Okay, so far everything's looking really good. Now I want to check for facial strength to see if there was any facial nerve injuries. So lift your eyebrows as big as you can for me. Scrunch those down, good. And now squeeze your eyes as tight as you possibly can and don't let me open them, okay? Good, she has good healthy strength. So that's important for traumas, for strokes, and also very important when you're doing an eyelid surgery evaluation. A lot of people have had Bell's palsy and it's resolved over time by appearances, but when you check the orbicularis strength, you might find that it's decreased significantly compared to the unaffected side. And that's something good to know before you do a blepharoplasty surgery to make sure you're not going to induce any lag ophthalmos postoperatively. Okay? And then I want you to do me a favor, clench your teeth like that. Does your jaw feel aligned?
Mm-hmm.
Okay. Any pain when you bite down on your jaw?
Mm-mm.
No? Okay. All right, and so when I'm doing a facial fracture exam, I'm also going to check for instability or movement in the maxilla. So excuse me 1 second while I put on a glove. Okay, and I'm going to put my gloved hand in your mouth, and I'm going to go on either side of your upper teeth, and I want to see if there's any mobility in your mid-face region, okay? Okay, so I'm going to gently put my gloved hand inside of the patient's mouth. I'm going to go on either side of the upper teeth, and I'm just basically gently wiggling the maxilla back and forth. If there's a lot of instability, you'll feel it, and that will help guide your surgical decision making and also be a reminder for you to make sure that the patient follows a soft diet so that they don't induce further instability until we have a chance for the fractures to heal. Okay, so far everything's looking good. The one other test that we want to really do with an orbital patient, especially if there's concern for an orbital tumor and you want to see if it's vascular or not, there are two things we want to do. One, we want to listen for a bruit, so we're going to auscultate with a stethoscope. Two, we want to check for increased proptosis with Valsalva type maneuvers, as that will push the eye forward with the Valsalva, which will help sort of lead you down one differential diagnosis path. All right, so with the stethoscope, you're actually going to put the stethoscope over a closed eyelid and then listen. And if you hear a bruit, it's a very concerning finding and you want to get imaging as soon as possible, okay? Okay, gently close your eyes for me. Perfect. Good. Very good. Okay, no bruits. All right, and now we want to check the exophthalmometer post-Valsalva. So you want to set your base back to where it was. Hers was at 101. Okay, Meg, here's what I want you to do. I want you to pinch your nose, and then I'm going to have you lean forward and pretend like you're blowing up a balloon or trying to make your ears pop. Basically what I want to do, I want to see your face get red. Okay, so that will mean that we're building up a lot of vascular pressure in your face, okay? So lean over and then blow out and really bear down, use your stomach and everything, because so you see her face is turning red. That's perfect. If they'll tolerate, I'll have them do it for up to 20 seconds. I have my exophthalmometer ready to go and have them look straight ahead. I'm going to put it right back and I'm going to look at the eye that I'm worried about first. Okay, and look straight ahead. I want the center of that cornea right on the line, making sure I'm parallel to the floor. Good. Okay, and there's no increase in proptosis or change in the measurement, so you're doing great.